Hi, I'm Dr. Michael Ritchie, and thank you again for joining us. Today, we're joined by Dr. Misty Purfast. Dr. Purfast is our newest addition here at the Ritchie Eye Clinic, recent graduate from the Southern School of Optometry.
Yep.
Dr. Purfast brings with her back to Faribault some very interesting ideas and perspectives, and we'll get to that in a moment. First, Dr. Purfast, I'd like you to please give us a little background. Tell us how you got to this point.
Okay. I grew up in Faribault on a farm, kind of halfway between Faribault and Kenyon. So I was born and raised in Faribault here, real involved in 4-H and all of that. I did my undergrad up at North Dakota State University in Fargo. And then for optometry school, I went to, like he said, the Southern College of Optometry down in Memphis, Tennessee. So it's really nice to be back in the Midwest, and especially back in Faribault.
Now, Dr. Purfast joins our clinic as our third optometrist, joining Dr. Murray Hansen and Dr. Bruce Gustafson. But as a new grad, Dr. Purfast brings with her some new ideas and some new interesting programs. One of the programs that Dr. Purfast is very interested in is a program called the Infant C program. Dr. Purfast, tell us what that is, please.
Infant C is a program that is funded by federal money, and it goes towards infants anywhere between 6 months and a year old, and it provides for a free comprehensive assessment of their vision and eye health. A lot of times infants exams happen in the pediatrician's office, and this can be a very quick screening and doesn't always pick up everything that might be there. So when the infants come in, we're going to check their eye muscles, check for any lazy eye, and then dilate the eyes, and also check the back of the eye to make sure the retina is healthy. And I've actually picked up a few things on those assessments that wouldn't have normally been found until a later age.
Now, every pediatrician's office is still going to continue to do their routine screenings.
Yes.
This is considered an additional step and sort of an additional preventive measure, if you will, for ways to try to catch problems in kids. Now, is every child eligible for this, or are there certain criteria?
Every child between the ages of 6 months and 1 year old is eligible. There's just some paperwork that we fill out at the office. It's pretty simple and easy.
So, as a parent, what do I do to get my child in for this exam?
You can just call our office and say that you want an Infant C exam scheduled, and we'll take care of the rest of it here. It doesn't get billed through insurance or anything like that. It's completely covered as long as they're between 6 months and 1 year.
Are people going to be able to find information about Infant C at their pediatrician's office, or would they be better off? Is there someplace they can find information on the internet?
The internet has a lot of good information about it. It's just how it sounds, Infant C, S-E-E. Also, I know Rice County Public Health has information about it, and there are brochures and pamphlets that we have here that you can pick up.
All right. Well, I appreciate that. Now, this is not your sole focus, correct?
No.
In addition to this is just one of the things that she brings with us as sort of the next generation of eye doctors here in the office. You will still have this broad interest in general care.
Yes.
Routine eye exams, diabetes, following people with glaucoma, contact lenses, spectacle corrections, everything that we would normally do here at the eye clinic.
Right. I just saw it as an area that we're not really focusing on right now, so I think it's a good way to kind of add a little bit more to what we do here at the clinic.
And you help broaden our focus. Wonderful. Thank you, and welcome to the clinic. Welcome back home.
Thank you.